Hi there, my name's Leanne. I'm doing this video today to start up a YouTube channel. Basically, just to give you a bit of a background, I am 25 years old. I am from Birmingham, well, Dudley, the West Midlands, and I have battled with several health conditions over the last 6-7 years. So really I just wanted to sort of give everybody a little bit of information regarding the issues that I have, and maybe if you can relate or you know somebody who has a similar illness or disease, then maybe you could recommend this video to them. Really just trying to raise awareness and give people information, because sometimes if you know somebody has an issue or a problem, you could be afraid to ask what that means for them. So this is to just introduce you into my world a little bit. For those of you that do go on social media and they use platforms such as Facebook and Instagram, then I do have a Instagram page dedicated to my sort of journey. It's a bit of an online blog if you like, but I do it on Instagram, and you can find me at chronically Lanny, which is Lanny, and that just contains more information, and I upload pictures on there and give everybody some updates. So to start off, disclaimer, I am not a medical professional. Any opinions expressed in the video are my own, from my own experiences, so yeah, please don't take anything personally if anything I say seems incorrect or maybe different from what your experiences are. Okay, so I think we'll start at the very beginning. So I was a very normal teenager health wise. I didn't have any problems really. I was a keen dancer, and just overall quite well, I suppose. I mean, I did have, sometimes if I got ill, I was typically ill a little bit longer than the average person, but apart from that I was pretty much okay. And then in 2011 we had a family bereavement, and that sort of incident, that trauma that I experienced from that, I think kind of then kick-started the deterioration in my health. From 2011 my health slowly started to decline, and I was suffering with very bad bowel problems at the time, and over like a 2-year period from 2011 to 2012-13 I started to experience lots and lots of different symptoms. So one of the first things I experienced was fatigue, really tired all the time. The second thing was really bad repeated mouth ulcers, and they was just chronic and so sore. As soon as one went, another one would pop up. So I had lots of problems with mouth ulcers, and then sort of bowel issues were becoming a big problem for me, and I had been to the GP and spoke to them about it. My mum has IBS, which is very bad IBS, and she's had it all her life, and she's taken medication since the age of 15 for it. So I know there's a family history of IBS there, and we thought that perhaps it was that, and that was grumbling a little bit. I did suffer with anxiety through high school. So you know, anxiety and an upset stomach usually go hand in hand. So IBS was looking like the main factor at that time. A little bit later on, towards the end of 2012, I was experiencing a lot of other symptoms. So I had experienced lots of weight loss. I went down at one point just to 8 stone. I was very slim, very malnourished. I had an iron deficiency. I was cramping all the time, really bad stomach cramps. pain when I needed to go to the toilet. I was going to the toilet maybe 6 to 10 times in a day. Constant loose stools and very bloody stools. And for a long time, those sort of things I just thought would get better, so I didn't do much about them. But when it got that severe, when it got to that point, I was like, okay, there's something really wrong here. So I went back to the GP, explained, and they referred me to a gastro consultant at the hospital. Sorry. I had some tests done. I had to have a colonoscopy. And for those of you that don't know what a colonoscopy is, it's basically a very long, thin tube with a camera on the end, and they insert it into your bottom and push it up and round the bowel, so they can take like images and pictures, and if necessary biopsy, you know, the intestine and the large bowel. So I had that done, and almost straight away, when they was doing the colonoscopy, they could see very clearly that the lining of my bowel wasn't normal. It was very red, very inflamed, very bloody, and very ulcerated. So very early on, from that very first day when I had that scan, they was fairly certain that I was suffering with an inflammatory bowel disease. Now, inflammatory bowel disease is very different from IBS. So with IBS, it's usually stress related, and you get things like, you know, painful trapped gas, cramps, needing to go to the toilet a lot, but that's sort of where the symptoms then end with IBS. With IBD, so inflammatory bowel disease, it's very different because it's an actual condition where the bowel it's suffering from an inflammation. So it gets very red, it gets very swollen, you can get ulcers, you can get bleeding, you can get perforation where it's just so bad and broken down that it, you know, your bowel perforates. So they are very, very different. There's two types of inflammatory bowel disease. Main types are Crohn's disease and ulcerative colitis. And at this point, they didn't know which one it was from just looking at it, because they look very similar. So they took some biopsies from different areas around the bowel. I believe they took 12 biopsies from me, so quite a few at that time. And they said they would send it off to the lab, and the report would be ready within 2 weeks. And I was referred back to the gastroenterologist, and from there on, skip 2 weeks later, I had my results, and they said that I do have inflammatory bowel disease, and they believe it to be ulcerative colitis rather than Crohn's. So at that point, I thought I had my diagnosis, and I could start treatment then. And treatment for inflammatory bowel disease, it varies so much from patient to patient. It really does depend on the symptoms you're experiencing, the severity of the symptoms, the consultant that you're under, the hospital that you're under, and such things. And there's lots of different types of treatments. So there is like oral treatments, there is IV treatments, there is injections, there is topical treatments, suppository treatments. There's so many different types, and it's all sort of angled towards what your bowel is going through at that time. So my gastroenterologist started me on a medication called mesalazine. So mesalazine is, he explained it to me, it's like paracetamol for the gut. So people with inflammatory bowel disease shouldn't usually take ibuprofen, because ibuprofen can exacerbate the symptoms of the disease. So where possible, avoid ibuprofen, which sounds a little bit contradictory, because the tablets that they put me on, the mesalazine, is like an anti-inflammatory for the bowel, but it's a very different type. So, and that was the first line treatment for me. He gave me the highest dose I was taking 800 milligrams 3 times a day, and I very quickly began to see a difference in my symptoms. They eased off rather well within, I would say, a 2-week period, and I thought, wow, this is getting it under control, this is really, really great. So that was really my beginning with inflammatory bowel disease. That was my first diagnosis, and that was in October in 2013. And I think from then on it's just been a spiral and a roller coaster of different hospitals, medications, examinations, diagnoses. Like, I've had lots of different health issues since then, all of which I will dive into in separate videos, so you can understand a little bit more about, you know, how each inflict with each other, and the order in which that I got them. So inflammatory bowel disease does not end there. You can have periods of time which they call a flare-up. So in your flare-up, that's when your symptoms are most present and most active. They're most severe, so you might feel that you're having a flare-up, like if you're particularly stressed out, or you've had some food that doesn't suit your bowel, or there's multiple different things that can affect a flare-up or influence a flare-up. And then you can go into periods of what they call remission, which is where you've managed to get the inflammation and the ulceration and all your symptoms under control. That may be using medication, it may not be using medication, it might just happen by itself. And if it does, that's really good. If not, then if the medication doesn't work, they have several different tiers and several different types of medication they can try, and each one just gets a little bit stronger and acts in a different way. So for me, I was started on mesalazine, which initially did work really well, but after a short period of time I noticed that the symptoms came back with a vengeance, and over the years I had to try many different medications. So I had to go on steroids. I was taking steroids for quite a long time actually, and steroids bring about their own set of symptoms and issues. You have to wean off them very slowly once you're on them. You have to carry a card to let everybody know that you are taking them. They're classed as an immunosuppressant, but they're a milder one. Even at a high dose, it's classed as a mild immunosuppressant. So I was taking steroids, which didn't suit me very well. They don't suit a lot of people, and a lot of people can't tolerate them, and they didn't help with the symptoms of my disease. My disease was quite bad. I had pancreatitis, so that was the whole of the large bowel was, you know, inflamed and ulcerated. For some people it's not the whole of their bowel, it's like a part of the bowel or the end part of the bowel, but for me it was throughout the whole, and it was moderately severe. And when steroids didn't work, the only thing left that they thought they could try with me was a biologic. So biologics are at the high end of treatment and what they can give to you for inflammatory bowel disease. They don't start you on biologics until the disease is advanced or it's very uncontrolled with, you know, previous medication, or you can't take other medications for XYZ reason. Then they will start you on biologics. So when you have biologics, you start by, they are basically sessions at the hospital. You would have to go in and sit for a few hours and have an infusion. So it's made up in like a big bag, and it's put on a rail, and they insert a cannula into your arm, hook you up, and then yeah, you sit there for like 4 hours and wait for that infusion to go through. Now they're very potent, they are very, very strong biologics. They're actually classed as similar to chemotherapy. They strip your immune system and they are very potent. I had 4 sessions of biologics, so I went every 4 weeks for 4 hours. And again, this varies from person to person. Some people might have it over a short amount of time or a longer amount of time, and they may have it like with different amounts of time in between each session, and that's just what I had. And I noticed rather quickly again that the biologics seem to help. Initially, in a way, they relieve the symptoms for a short amount of time, and then they become less effective, which sort of links in then with another medical issue that I had. So I think what I'll do is perhaps revisit that in another video, because that's something else completely on its own. But because of that issue, I had to stop taking biologics. I could no longer take them. They wasn't suitable for me. So yeah, that was sort of the end of the road when it comes to medication and treatments for inflammatory bowel disease with me. The doctors were at a bit of a loose end, and because of this other issue, I was unable to take any more immunosuppressants. So anything else that would compromise my immune system, any other medications would not be suitable for me, so I had to come off them all, which you could probably understand why my bowel then went into a big massive flare. It like worse than it's ever been, really, and it never recovered. It never got better. So in between 2013 and 2016, I was struggling really bad with the inflammatory bowel disease. I was going up to the toilet up to 20 times in a 24-hour period, lots of excessive bleeding, lots of urgency. I couldn't go out anywhere, I couldn't work, I couldn't enjoy my life. I was up in the night, having so many problems, and again very, very malnourished, very, very slim, and it really was affecting my mental health at that point. And I had to go in for an admission. It wasn't a planned admission. I had to go into the hospital because of the symptoms I was experiencing, and that's when the decision was made to go ahead with emergency surgery to remove my large bowel. So that operation, it wasn't planned. I didn't even think prior to that admission if that's something that I would ever want or if I would ever consider. It sort of just came about very quickly, and within like 3 days I'd been admitted to hospital, and a consultant had decided with me that the best way forward would be surgery, because medications were no longer an option for me and I can't get my bowel under control. They felt that it would be necessary for me to have the surgery to remove the diseased bowel. So that is what happened, and in 2016, on August the 9th, I underwent emergency surgery where they took away the large bowel and gave me an ileostomy. And for those of you that don't know what an ileostomy is, it's basically an opening in the stomach where they pull through the intestine and stitch it up, and you would wear a colostomy bag over the top. So I don't have any large bowel anymore. I only have a small bowel, and that has been pulled through my tummy, and I wear an ileostomy bag every day now. Now this isn't something that everybody that has IBD will have to go through. This is the end game for a small portion of people, not everybody. With a lot of people, they will get the inflammation and ulceration under control with medication, or even just therapeutic variations. Some people find meditation, less stress, a healthy diet, or help in reducing the flare up of the symptoms, which is great. If you can do that and that works for you, absolutely brilliant, because the less medication you are on, the better. But ultimately for me, that just, it was never going to happen. That wasn't the case. So we had to you know, take further actions to resolve the issue, and that was the surgery, which was kind of a big deal really, just to try and get my head round like that quickly. I thought mentally I would cope with it, and I thought I would struggle physically. That was my going into the surgery. That's what I actually thought. I thought, okay, I'm having this done, it's gonna be fine. Mentally, I'm just know it's got to happen. I'm gonna be better after I've had it done. All will be well. But it was just actually the thought of, you know, having this colostomy bag and what that would mean for me going forward, and how it would change my life in a physical way. But I'm glad to report that I actually took to my ileostomy really, really well, really quickly. So I nicknamed him Tommy, Tommy because of ileostomy. So bit of a weird one, but at the same time I like Tommy, and Tommy is very good most times. Tommy sometimes can be bad, but that's a whole nother topic. So my decision to have the ileostomy, I will never ever regret, because it's given me back so much quality of life. I can do so much now that I couldn't do before. You know, I can go out the house without worrying. I'm not in pain all the time. I'm not going to the toilet 20 times a day or getting up in the night. You know, my physical health has improved somewhat, but you know, with other issues it's also deteriorated. So I can't say I'm overall cured, although the bowel is actually, because it's been removed, I can never get that again. I can never get the ulceration, I can never get the inflammation. It's gone now. So from that perspective, that is the only way they can cure IBD, is to take it away, and that's what they've done with me. So my IBD is actually, if you like, in full-time remission, because I just don't experience the symptoms anymore, which is superb. So yeah, Tommy was born in August 2016, so I've had him for 3 years now. It's coming up to 4 years this August, so in a few months time it could be 4 years. Oh, so I can't believe it's been that long. It really doesn't feel like it. And I am so glad I had it done. I don't regret it at all. I'm not going to lie, the recovery for it was not easy. I mean, in fact, it was very traumatic. And again, this is not the standard sort of thing that happens with everybody. And for most people, you know, the recovery time is, well, you stay in hospital initially for 5 to 7 days normally, and after that time they'll discharge you, and then recovery at home can be anywhere between 8 to 3 months. That's when you feel like at your best after that time. For me it was very different. I had complications after the surgery, which meant that I then had to go and have another operation, and I had to have a drain put in because I had a collection of fluid in my pelvis. So the operation time should be 5.5 hours for the kind of surgery that I was having, but for some reason with the complications I experienced, I was in surgery for 9 hours, so quite a long time. And when I came out of the operation and they tried to bring me round, I really didn't respond well at all. I was in very bad shape. and I was admitted to the intensive care unit for 3 days. So my recollection of my time in ICU is very small and very slim. I don't remember too much. I only remember little bits and pieces, and things that obviously my family have told me about. But after those 3 days, I was then moved to a ward, and I was on a ward for a couple of days, and I'd not made any improvement at all. I was still in copious amounts of pain. They couldn't keep my pain under control. And then I think it was 5 days after my initial surgery, so after 3 in intensive care and 2 on the ward, the consultant come back around to see me and decided that something was wrong, something was not right, and that they needed to go back in, operate, and see if they could fix whatever the issue was. So at that point then it was decided that I would go back under general anaesthetic so that they could resolve any issue. So all in all, after that I spent 4 weeks in the hospital, and I stayed in the Queen Elizabeth Hospital in Birmingham. Those 4 weeks felt like a lifetime, and I honestly felt like I was never going to get better. It was a really big struggle for me, but I'm so thankful that I had such a superb family. They were there every single day. My dad would come every day after work, and there is a Costa coffee on the hospital grounds, and he would go in and get my favourite coffee for me, and he'd bring it up. And you know, I was really fortunate that on, you know, my very worst days and nights, that my mum actually stayed with me, just to try and keep me calm and to help me. So after that 4-week recovery time, I was then discharged home, and I continued then to make a recovery from home, and it took me, I would say, after 6 months I was okay, but I didn't recover fully and feel well until 12 months after my operation. So it was a very, very, very long time before I felt anything like normal. Again, this is not typical for most people, it's just how it happened with me, unfortunately. Things never seem to run very smooth, but you know, it's one of those things. I can't change it, it's just how it is. And like I say, I'm so happy now with the outcome and how I feel, and the ileostomy doesn't bother me at all. Like, it's really not an issue. It's way more convenient than how I was before, being in pain, always needing to be near a toilet, not being able to go out. So yeah, that is my experience with inflammatory bowel disease. Since having the operation, I made a full recovery. I now don't take anywhere near as much medication as I used to. I don't take any anti-inflammatory medications. All I take is an iron supplement and vitamin D, because I am deficient in both of those. So yeah, I take those 2 supplements every day. So apart from that, I'm doing really, really, really well. Yeah, 4 years coming up, and just super duper proud of myself, super duper proud of the hospital for looking after me. And yeah, this is not the end of that story, but it's the end of the inflammatory bowel disease. So yeah, I'm sorry this video has been quite a long one today, but it's kind of hard to break all the topics I want to talk about into different sections, because they all kind of interlink. But I wanted to give you the information and my experience in blocks of what would make sense and what would be understandable for others. So I hope that has given you an insight into inflammatory bowel disease and my experience. I'll come back with another video, just linking on to other topics shortly. But if you know anybody that has IBD or anybody that you think would benefit from this video. If you have any questions, then please like, share, subscribe, comment, and I'll do my very best to get back to you all. Okay, that's all for today. Thank you so much for staying with me if you watched the whole video. I'm sure my next video won't be as long as this, but everyone's got to start somewhere. But I hope you are, in other news, yes, staying safe at the moment with all the coronavirus. I know that there's a lot of people in isolation and they're feeling very lonely. Some people don't have a lot to do or anyone to talk to. So hopefully this is a video that, you know, might keep you, wasn't entertained as such, but gives you something to focus on for a short while and take your mind off what's happening in the world. But yeah, stay at home, stay safe, and help protect our NHS. Apart from that, I just wish you all the very, very best, and I'll speak to you again soon. Thank you so much. Bye.